Okay, continuing on with our test-taking strategy integrity videos, we are going to tackle a new kind of question that everybody sees in their practice questions, and they don't know how to do it, and it's confusing, and you definitely will see questions like this in this course, and so I want to talk about how to answer them, and that's those pesky, who do you see first questions. So first, let's do some general review of our general test-taking strategy. Our first step is always going to be to look at the question and figure out what the question is really asking us about. If you are a person that highlights stuff in your question and you find yourself highlighting 75% of what's written in the question, that means you're having trouble identifying the topic because you think everything is important and you're afraid to throw any piece of information away. So practice figuring out what the topic is and what is extra information that you don't need. So you're going to decide what the question is asking you, then you're going to uncover your answers, eliminate incorrect answers or answers that may be correct but are not as high priority, or answers that don't match the topic of your question, that maybe they match another piece of the information that you were presented. And if you've eliminated and you've got one answer left, that's the answer you're going to pick. So don't get stuck. Don't change your answers. Most people talk themselves out of answers that they think are too obvious or too easy, and they try to make it more complicated. Don't make up stories. Remember, this is important, and I did not include this the last time. Remember, the answer that you may have wanted might not be there. A lot of times students have been taught to predict what the right answer is going to be. And I'm going to suggest that you don't do that. Because if you are looking for a particular answer and you look at the responses and it's not there, you're going to try to pick the answer that's closest to the one you were looking for, even if it doesn't make sense. So identify your topic and then move on to your answer. So let's do some practice in who do you see first questions. We're going to do these a little bit differently. Who do you see first questions require you to find the least stable patient. The least stable patient is the patient you're going to see first. In order to find the least stable patient, you are going to eliminate people who have expected symptoms for their illness or injury, eliminate people who are stable, and then try to go ABCs. You may also need to consider who has a chronic condition versus an acute condition. That might be a way we need to go. We'll discover a couple of different things in our few practice questions here. So in this question, the nurse comes upon a multi-car accident, and you've got 4 injured people. You've got to decide who to see first. Our first person is an 18-month-old female who is crying. Hematoma noted on the forehead. Abdomen is rigid and distended. So, is this a stable patient or an unstable patient? Well, I'm not exactly sure, but it doesn't sound good. I got to think about what is the worst thing that could be happening. The kid has hit their head, and now it looks like something's going on in that belly. 15-year-old male complaining of severe pain in the left leg, moderate bleeding noted from an open femur fracture. Well, I know that if I have an open fracture that there's bone poking through the skin and there's going to be a little bit of bleeding from that. The severe pain is consistent with the pattern of injury, so I'm already thinking that B does not look as important as A. 16-year-old male is difficult to arouse. Respirations are shallow and irregular. So I'm not sure what's going on with this person, but seems like there may be some airway breathing issue going on. So that doesn't sound good. I'm going to hold on to that one. 78-year-old female complaining of chest pain. Diaphoresis is noted. Heart rate is rapid and irregular. Okay. So A looks like a circulatory problem to me. A rigid and distended abdomen indicates that perhaps there is abdominal bleeding. So that looks circulatory to me. B I've already eliminated. It's not an ABC problem. Even though there's a little bit of bleeding, it's not as bad as some of the others. C looks like an airway breathing problem to me, and D looks like an MI. That looks like a circulatory problem to me. So out of all of these patients, I need to see the airway breathing patient first, and that's going to be option C is the right answer. This would be consistent with a head injury. Anytime you see respirations are irregular, that's not normal in a grown-up and probably indicates a neurogenic breathing pattern. If the patient has a head injury and has a neurogenic breathing pattern, they're not going to keep breathing for very much longer, and I need to intervene with that patient first. So C. Here's our next one. The nurse receives report on the med-surg unit. Which of the patients should you see first? Patient reporting sharp pain in the chest with inspiration. A patient who complains of severe low back pain and blood in the urine. Patient reporting chest pain after receiving nitroglycerin sublingually 5 minutes ago. Patient admitted for migraine headaches reports head pain of 10 out of 10. Well, let's think about eliminating people who have expected symptoms for their diagnosis. D looks pretty expected to me. Somebody that I already know has migraine headaches is reporting that they have a bad headache. Nobody ever fell over dead from pain, and especially pain that I already know is happening, so I'm going to eliminate D right away. I'm looking at B and wondering what is the very worst thing that could happen here. Severe low back pain and blood in the urine, well, gosh, that could be kidney stones. It could be pyelonephritis, or, just some kind of nasty UTI. They don't tell me that there's any kind of trauma. Don't make up a story that they're exsanguinating buckets and buckets of blood in their urine. It sounds like whatever's going on in there is, consistent with the complaint of low back pain. It's not an ABC problem. I'm going to eliminate B and D. So now I'm only down to between A and C. If I think about sharp pain with inspiration, I've got to think about what's the worst thing that can be. That sounds like it could be a pulmonary problem. It's not real specific. It could be pleuritis, but I'm not real sure. C, though, C, I've got a patient that's having chest pain. They got nitroglycerin, and they're still having chest pain. So I've definitely got an acute problem that can't be dismissed in C. I don't know that A is an airway breathing problem, but I know C is a circulatory problem. It's happening right now. That patient needs to get some more nitroglycerin for sure and maybe some follow-up. So C is going to be my highest priority patient. That was a close call between A and C. Don't make yourself crazy if you didn't get that one right. Let's do one more. The nurse cares for patients on the surgical unit. Who are you going to see first? Patient who had a thoracotomy has milky yellow drainage in the chest tube. Patient who had a total hip replacement is restless and short of breath. Patient who had a prostatectomy is complaining about the inability to void. A patient who had an abdominal aortic aneurysm repair is requesting meds for pain. Once again, I want to eliminate people who have expected symptoms for their illness or injury. D looks pretty expected to me. Somebody who had a AAA repair is going to have pain. They're asking for pain medication. That's totally normal. I don't need to make up a whole story about how they've ruptured their repair and they're bleeding out into their belly because it doesn't say that. So I'm going to eliminate D. Somebody that had a prostatectomy frequently complains about frequency and urgency. I do need to check on that patient. That's not an airway breathing circulation problem. They can wait another 30 minutes or so until I deal with somebody else. So C and D are out. Now I'm down to A and B. I'm going to look at A and think, what is the worst thing that could be happening here? Milky yellow drainage sounds purulent to me. It sounds like an infection. But that's not an ABC problem. It took them 2 or 3 days to grow the infection. They can wait another hour for me to go see them. However, in B, what is the worst thing that could be happening? I have a patient with a total hip replacement. Those people are at risk for fatty embolism or pulmonary embolus from clot. The patient is restless. Restless isn't right. That can indicate hypoxia. The patient is already short of breath. That sounds like an airway breathing problem to me. B is my most acute patient. I need to see B first. Remember, with these questions, you're going to see all of the patients. You just need to decide who to see first based on their acuity. Oh, I do have one more here. The nurse in the oncology clinic receives 4 phone messages from clients. Which of the following clients should the nurse call first? So this time we're not looking at the patients. We've got to decide who to call back. Client diagnosed with leukemia receiving chemo complains of fatigue and loss of appetite. A client who had a nephrectomy 2 weeks ago and complains of itching at the incision site. Client newly diagnosed with colon cancer reports dark, tarry stools. Client diagnosed with lung cancer requests a refill of pain medication. Okay. Once again, I'm going to try to eliminate people who have expected things. In A, do I expect someone who has cancer and is on chemo to be tired and not feel like eating? Totally expected. It's not an ABC problem. I can call them back a little bit later today. A is gone. I'm looking at B. Patient had surgery 2 weeks ago and their incision is itching. Well, I totally expect that too because that happens, especially as incisions heal and the scabs start to fall off. That can get itchy. So A and B are gone. My only choice is down to between C and D. What's the worst thing that could be happening in C? Well, I know that people with colon cancer get blood in their stool. That's part of the diagnostic criteria. But dark, tarry stools, that doesn't sound like a little bit of blood. That sounds like maybe the patient is GI bleeding. And perhaps that's a circulatory problem. Let's compare that to D. Patient has lung cancer and they just need more pain medication. Well, I expect somebody with lung cancer to need more pain medication. I know that we emphasize pain in nursing school, but nobody's going to fall over dead from pain that I expect them to have. So compared to pain that's expected and the possibility of bleeding in C, I have to pick C as the patient that I am going to see first. That brings us to the end of our Who Do You See First question category. So when you see questions like this on a test, remind yourself, I need to eliminate people with expected stuff. I need to eliminate people who are stable. And then I need to try to go ABCs. Try to see what's there and don't add anything to it. It's kind of a hard balance, but the more you practice, the better you'll do. So until next time, this is Christine Morris signing off.